taking that implant technology, they said, well, what about designing an implant for high nearsighted people? Because the limitation with LASIK in high nearsightedness was how flat the cornea would end up. Remember, we flatten the cornea for LASIK correction for nearsightedness. But in super high corrections, it becomes very flat, like this tabletop, and it can cause some visual aberrations, some visual symptoms. So we can avoid the cornea by putting a very high-powered corrective implant inside the eye. But we're not going to remove the lens like in cataract surgery, because there's a young person, a 20-year-old with a clear lens, for example. They specially designed an implant to slide in the very, very tiny space behind the colored part of the eye, see it here, and in front of this natural lens. And it's called an ICL, which is an implantable collamer lens. Collamer is the type of material it's made of. And it's a very simple procedure. A little incision is made in the periphery of the cornea. Pupil is dilated with drops, and they just inject this soft implant and tuck it right behind the colored part of the eye, and it sits in front of this natural lens and focuses light rays onto the back of the eye, and people see. And it really is a miraculous procedure for these folks that nothing could be done for them, who have a true handicap. For us here, we basically use them for patients who either have significantly high levels of nearsightedness beyond what LASIK can correct, or folks that may have some abnormalities in the shape of their corneas, whereby trying to change the shape with the laser may not be as predictable. And we're happy to offer it here at Magruder Laser Vision.